Acid reflux causes heartburn and chest discomfort, especially after a meal or while lying down. It may cause a sour or bitter taste in the mouth, a feeling of a lump in the throat, or a sore throat and a chronic dry cough. Almost 20% of the adult population has acid reflux, especially much more who love to eat large meals, have a chronic cough, or who are overweight or obese. Acid reflux is when stomach acid repeatedly flows back into the esophagus, which is not normal. The esophagus is not intended to withstand an acid environment, so it causes symptoms like heartburn and discomfort in the chest. Over time, the esophagus can be seriously damaged and even cancer can develop. That's why we should not leave acid reflux without attention. We'll talk about how to ultimately treat acid reflux, even if it reoccurs after previous treatments. First, let's say what the distinction is between acid reflux and GERD, Gastroesophageal Reflux Disease. Acid reflux is when a person occasionally feels heartburn, especially after heavy meals or after certain foods. Anyone can experience it from time to time. And GERD is when the process is more clinically serious and causes damage to the esophagus, or symptoms so frequent that it interferes with daily life or sleep. Now let's say when the treatment is applied directly, commonly without an endoscopy study, and when endoscopy is required. If a person is more than 50, 60 years old and has symptoms of GERD, endoscopy is needed. Or if a person has difficulty swallowing or painful swallowing, unexplained weight loss or black tarry stools, low hemoglobin, which are the signs of bleeding or anemia, or persistent vomiting, then they also should undergo endoscopy.
Especially males after 50, if they have long-standing acid reflux symptoms or severe symptoms, are also overweight, and smokers have a higher risk of metaplasia of the esophagus. This is a major risk of esophageal cancer, which is insidious and aggressive and requires immediate attention. An important part of treatment is lifestyle modifications like weight loss, eat small portions instead of large meals, avoid late-night meals and triggers, finish eating at least 2-3 hours before bedtime to reduce nocturnal reflux. Patient avoid foods like caffeine, alcohol, chocolate, spicy foods and fatty foods, citrus and carbonated drinks. Also avoid tomatoes and tomato-based products, also acidic. Mint also relaxes the esophagus and increases reflux.
Chewing sugar-free gum can increase saliva production, which helps neutralize acid that may have rexed into the esophagus. Sleep on the left side of your body. Elevate the head of the bed. Raising the head of the bed by 6-8 inches AG, using blocks under bedposts or a foam wedge can lessen nighttime reflux. Avoid tight clothing around the waist. Remain upright after meals. Sitting or standing for 30-60 minutes post-meal aids in gravity-assisted gastric emptying. Core medication treatment of GERD is proton pump inhibitors like omeprazole, lansoprazole, pantoprazole, or rabeprazole. They're taken usually once daily before breakfast, 30 minutes earlier. For example, omeprazole 20 mg once daily, up to 8 weeks. If symptoms improve during the period, it further supports the diagnosis of GERD. If symptoms reoccur quickly or symptoms persist, then increasing the dosage is possible, and consider endoscopy or other studies to evaluate the causes. For 80% of patients, they will recover after this treatment in 8 weeks. Also, even it will recover esophageal inflammation.
The proton pump inhibitors block the enzyme system on gastric cells, and the production of gastric acid is reduced. Long-term intake of proton pump inhibitors is sometimes needed, but it can increase the risk of B12 deficiency, reduced absorption of calcium and magnesium. It also may increase some serious risks if taken for years. If night symptoms persist, H2 receptor blockers are added at nighttime, like famotidine and nizatidine. They block histamine H2 receptors in stomach parietal cells, decreasing acid secretion, but less than proton pump inhibitors. To improve gastric emptying and gastrointestinal motility, prokinetics can be added. For example, metoclopramide, domperidone, and low-dose erythromycin, they increase gastrointestinal motility and accelerate gastric emptying. Therefore, reduce the time acid spends in the stomach and lessen the chance of reflux. Domperidone and erythromycin are considered safer, but they are not the first-line treatment of GERD. They are recommended when documented gastric edema. Clofen can be used to lower esophageal sphincter relaxation, but it has side effects like drowsiness and dizziness and is not recommended for the long term. Usually, this treatment is reserved for refractory GERD cases. The dosage should be low and short term because of serious side effects. Antacids work quickly to neutralize stomach acid, making them ideal for on-demand or as needed relief of intermittent or mild reflux symptoms. Antacids are not intended for long-term management of moderate or severe GERD, but rather for sporadic symptom relief, especially after known triggers, e.g., a spicy meal. Calcium carbonate and milk of magnesia are one of the most commonly used antacids. Alginates like Gaviscon creates a foamy raft that sits on top of stomach contents, helping prevent acid from splashing back into the esophagus. Gaviscon is safe for most people. Commonly taken after a meal or before bed, ferrous sucralfate forms a protective barrier over esophageal erosions or ulcers. More commonly used in peptic ulcer disease, but can be used adjunctively in GERD for mucosal protection. Typically taken several times a day on an empty stomach, considered safe. In rare cases, can cause constipation. Alginates and sucralfate are considered very safe for long-term intake. In severe cases, when treatment is not effective, surgery is the option. A surgical procedure where upper portion of the stomach fundus is wrapped around the lower esophagus to reinforce the lower esophageal sphincter. It is called laparoscopic Nissen funduplication. Other surgical procedures can also be used.